Hello friends, here we are going to learn about the nursing care plan on intestinal obstruction. This is very important nursing care plan for students for the examination purpose and also for the file work. Here we write this in nursing care plan by the use of various nursing process step like nursing assessment, nursing diagnosis, desired outcome, intervention, rational and evaluation. Let's we go with this nursing plan now. Here, before going to learn about this nursing care plan, here we first see the intestinal obstruction. This is here introduction for this disease. Here this intestinal obstruction, also known as the bowel obstruction, same here, is a condition wherein there is a blockage that prevent food or fluid from entering either the small intestine, small bowel obstruction, or the large intestine. मीन्स जो इंटेस्टिनल ऑब्स्ट्रक्शन है उसको हम बोल ऑब्स्ट्रक्शन के नाम से जानते हैं। इसके अंदर जो हम खाना लेते हैं और फ्लूइड रहते हैं वो इंटेस्टाइन के ऑब्स्ट्रक्शन के कारण स्मॉल और लार्ज इंटेस्टाइन नहीं पहुंच पाता है। इंटेस्टाइन में किसी भी प्रकार की रुकावट के कारण ये ब्लॉकेज के कारण ये एंट्री बिल्कुल रुक जाती है, तो इसको कहते हैं इंटेस्टिनल ऑब्स्ट्रक्शन। एयर Causes of intestinal obstruction. The causes of intestinal obstruction may include the fibrous band of tissue adhesion in the abdomen that form after surgery, hernias, colon cancer, certain medication or strictures from an inflamed intestine caused by the certain conditions such as Crohn's disease or diverticulitis. Yeah, these are the causes, and now we see the picture of intestinal obstruction disease here. They are encircle their stricture present here. आप यहाँ पर देख रहे हो, दिस इज ऑब्स्ट्रक्शन। स्ट्रक्चर मीन्स एक तरह से नैरोइंग ऑफ द इंटेस्टाइन, जो यहाँ पर सिकुड़ा हुआ है, और ये दिस इज द इंटेस्टिनल ऑब्स्ट्रक्शन। नेक्स्ट देखते हैं डिफाइनिंग करेक्टरिस्टिक्स ऑफ दिस डिजीज। मीन्स इस डिजीज़ के जो भी साइन सिम्टम्स है वो इसमें क्रैम्पी एब्डोमेन पेन दैट्स कम एंड गोज, लॉस ऑफ एपेटाइट, कॉन्स्टिपेशन, वॉमिटिंग, इनएबिलिटी टू हैव ए बॉल मूवमेंट और पास गैस, स्वेलिंग ऑफ द एब्डोमेन। नेक्स्ट देखते हैं हमारा जो मेन टॉपिक है आज का, नर्सिंग केयर प्लान और इंटेस्टिनल ऑब्स्ट्रक्शन। हेयर नर्सिंग केयर प्लान नंबर फर्स्ट, इम्बैलेंस न्यूट्रिशन लेस देन बॉडी रिक्वायरमेंट। Here we write nursing care plan in different step. Here first nursing assessment, assess the nutritional lab values such as albumin and electrolyte level. Next assessment, monitor intake and output. Next number third assessment, assess nutrition and diet. Here after this assessment we here write the nursing diagnosis. Here imbalanced nutrition, less than body requirement related to restricted intake as order to rest the bowel and altered absorption of the nutrients. Here a desired outcome is to maintain nutritional status. Here intervention and rational first intervention, maintain NPO status or as ordered. Rational is this reduce hyperactivity in the bowel and decrease vomiting, which will limit the loss of fluid and nutrients. Next number second, weight daily. Daily weight can help evaluate the patient for malnutrition. Number third intervention, monitor intake and output. A rational for this to make the fluid volume. Next number fourth intervention, encourage the patient involvement to help ease the patient's pain. Next number fifth intervention, resume diet as tolerated. Encourage the patient to advance their diet slowly and starting with a clear fluid diet and then moving on to the smaller meal. Here intervention complete for this diagnosis, and here we see the last step of this process, here evaluation, the maintain nutritional status of the patient। तो ये हमारा फर्स्ट यहाँ पर केयर प्लान कंप्लीट है। नेक्स्ट सेकंड देखते हैं हम, केयर प्लान नंबर सेकंड, दिस इज कॉन्स्टिपेशन केयर प्लान। हेयर nursing assessment for this assess the patient's pattern of bowel movement including the frequency and consistency of the stool. Next assess diet and fluid intake, next assess for the pain or straining with the defecation. Means after this assessment we write at the nursing diagnosis here. Constipation related to inflammation within the bowel, malabsorption, narrowing of the lumen. This is your nursing diagnosis and your desired outcome to relieve constipation. Intervention rational for this. Number first intervention, assess the patient's pattern of bowel movement, including the frequency and consistency of the stool layer. Rational is the this provide the baseline to the assess for any changes in their status. Next, inquire about the patient's diet and fluid intake. Here, this provide baseline information about the nutrients. Number third, here ask the patient if they have pain with defecating. Here, rational is the hemorrhoids are often caused by the staining and can cause pain. Here, next, provide a warm bath as appropriate. Here, for this, the warm water of the sitz bath can help relieving pain and discomfort. Next, encourage hydration. Adequate fluid intake help open the stool, making it easier to pass through the intestine and rectum. Next, encourage fiber when appropriate. Fiber would be encouraged to help with constipation but need to be very slowly. Too much fiber too quickly can cause abdominal distress or diarrhea. The patient may need education and fiber food and supplement at discharge. Next, encourage physical activity. A sedentary lifestyle can contribute to the constipation. Encourage walking in the hospital and once discharged as the increased gastric motility and emptier. This intervention complete. After providing this intervention, we write here the evaluation. Evaluation is the now constipation is relieved. Next, take the nursing care plan number third year acute pain year. Nursing assessment assess the patient type of pain, level of pain, sharp, dull, continuous, and the intensity of the pain here. Next assessment assess non-verbal pain cues. Non-verbal cues include the facial grimaces, restlessness, sweating, and abdominal guarding. Next, assess change in the vital sign. Patient may become hyperactive or tachycardic when their pain increases from their baseline. After these assessment, we write here the nursing diagnosis. Here, acute pain related to inflamed or inflammation of the scar tissue and constipation. Here, and goal is to relieve pain. Here, nursing intervention. Assess the patient pain level. Rational is here. Observe pain, location, description of pain, sharp, dull, continuous, and intensity. Next, second intervention, administer analgesics as ordered. Rational, managing pain is better achieved when the pain medication are given routinely. Next, intervention, maintain position of the comfort to rational is to facilitate comfort and decrease pain. Next, number fourth intervention, provide comfort measures such as massage, deep breathing, and guided imagery. Irrational is for this to help ease a patient's pain. Next, number fifth intervention, encourage patient for distraction activities. Here, rational is distraction activities such as watching TV, playing games, or reading can help focus the mind on something else as a way of coping with the pain. Next, place nasogastric tube. A patient with a small bowel obstruction will need a nasogastric tube to help decompress the stomach. Here, rational is that decompression will relieve abdominal distension and help decrease the patient's pain. Next, number seven intervention, cluster nursing care with the pain medication. Anticipate administering pain medication before pain is severe and then waiting until the relief is at its highest so the patient is most comfortable and in the least amount of the pain before tasks such as repositioning, ambulating, or bonding air interventions completed here. Now we see here the evaluation for this diagnosis. Here evaluation is now pain relieved and patient appear relaxed. Here nursing diagnosis number third, care plan complete. Next nursing diagnosis, take the number fourth. Here nursing diagnosis number fourth, ineffective coping. For this nursing diagnosis, nursing assessment assess the current situation accurately. Next, identify ineffective coping behavior and consequences. And next year, patient verbalize verbalize inability to cope, discouragement, anxiety, chronic worry, emotional tension, poor self-esteem. Means after on the basis of this assessment, we write here the nursing diagnosis. Ineffective coping may be related to situational crisis. A desired outcome is to maintain effective coping and nursing intervention here. Assess the patient and significant other understanding of the disease rational for this. Enable the nurse to deal more realistically with the current problem. Next, number second intervention, determine outside stressors, family, relationship, social or work environment are rational for this. Stress can alter autonomic nervous response, affecting the immune system and contributing to exacerbation of disease. Number third intervention here, provide opportunity for patient to discuss how illness has affected relationship. Rational for this. Stressors of illness affect all areas of the life and patient may have difficulty coping with the feeling of fatigue and pain. Next, number fourth, help patient identify individual effective coping skill here. In rational for this, use of previously successful behavior can help patient deal with the current situation and plan for future. Number fifth intervention, provide emotional support lessen the stress. Next, number six, encourage use of stress management skills, relaxation techniques, visualization, guided imaginary, deep breathing exercise here. Rationalize refocuses attention, promote relaxation and enhance coping abilities. Number seven here, administer medication as indicated such as anti-anxiety agents such as lorazepam, alprazolam adds rationalize adds in psychological and physical rest, conserve energy and may strengthen the coping abilities. Next intervention here, refer for the resources as indicated, local support groups, social worker, psychiatric clinical nurse, specialist, spiritual advisor. Additional for this, additional support and counseling can assist patient and significant other in dealing with the specific stress and problem areas. After providing these interventions, we write here the nursing evaluation step here, maintain effective coping. Now next, nursing care plan for here. This is last step for this disease here, deficient knowledge. Yeah, nursing intervention assessment for this, assess patient knowledge about the intestinal obstruction, including the its race, cause, risk factor, warning sign, and management. A nursing diagnosis for this deficient knowledge may be related to information misinterpretation of the disease secondary to bowel obstruction. Desired goal to improve knowledge level. Nursing intervention determine patient's prescription of the disease. Rationalize establish knowledge base and provide some insight into the individual learning need. Number second, intervention review disease process, causes, effect, relationship of factor that precipitate symptoms and identify way to reduce contributing factor, encourage questions. A rationale for this, accurate knowledge base provide opportunity for patient to make informed decision choice about the future and control of chronic disease. Number third, review medications purpose, frequency, doses and possible side effect. Here rationalize promote understanding and may enhance cooperation with regimen. Number fourth, rational fourth intervention here, Recommend cessation of smoking. Cessation of smoking can increase intestinal motility, aggravating a symptom. Next, emphasis need for a long-term follow-up care and periodic reevaluation. Your patient with intestinal obstruction. Patient with intestinal obstruction are at increased risk for tissue death or intestinal perforation and peritonitis, and regular and diagnostic evaluation is your intervention completed for this nursing diagnosis. And now we share the evaluation for this diagnosis, share improved knowledge level of the patient and significant others. तो ये यहाँ पर हमारा नर्सिंग केयर प्लान कंप्लीट हुआ है. तो फ्रेंड्स, आपको आज का वीडियो कैसा लगा इसके लिए अपने लाइक्स कमेंट जरूर भेजिएगा एंड शेयर दिस केयर प्लान वीडियो विद योर फ्रेंड्स एंड सब्सक्राइब माई यूट्यूब चैनल. जिन्होंने अभी तक सब्सक्राइब नहीं किया है प्लीज़ सब्सक्राइब करें और बेल आइकन को ज़रूर प्रेस करें. थैंक यू.